Well, on March 28th, Governor Kim Reynolds put her signature on a bill aimed at helping rural hospitals keep their doors open. Local 5's Larissa Leone joins us with a breakdown of Senate File 75 and what new laws it puts into place.
Stephanie, Senate File 75, also known as the Rural Emergency Licensure Bill, is described as a lifeline for rural hospitals by the Iowa Hospital Association. IHA says in the last decade, more than 140 hospitals in the U.S. closed, including one right here in Iowa. Now, with this bill becoming law, rural hospitals have more options to maintain service. The Iowa Hospital Association released a statement thanking Governor Reynolds and other leaders of this bill, saying, quote, "This bill provides a potential lifeline to our rural hospitals across the state, gives struggling hospitals another option to avoid closure, and ensures that local access to care is maintained." I spoke to Iowa Democratic Representative Heather Matson, a member on this bill subcommittee, who says there are a lot of rural communities across the state struggling to access emergency health care, leading them to shut down or struggle to stay open.
By creating rural emergency hospitals, it's allowing an opportunity for that healthcare to exist, even if it is just to be able to provide 24 hours of emergency care, just so that there is something close to home.
Iowa House Representative Dr. Megan Srinivas spoke about how these new options listed in the bill will help keep residents of rural communities alive.
We are extending our ability to give access to care to hundreds and thousands of Iowans throughout the state. And that's the most important part. This bill will save lives.
This bill gained support from the majority of members on both sides of the aisle, passing in the House 97-1 and the Senate 47-0 before receiving Governor Reynolds' signature. Republican Senator Chuck Grassley released a statement on the passing of this bill, saying REH is the most significant reform to protect access to essential rural health care services in decades. "I'm glad rural hospitals and communities in Iowa have one more option to sustain their operations and maintain health care access in the community." Representative Matson says it's important to note this bill becoming law doesn't necessarily mean hospitals will immediately make changes. It just means they have the option to open rural emergency hospitals in communities that need it. Matson says this change is not going to solve all existing rural healthcare problems, but it is a step in the right direction.